Your skin might be hiding these 15 diabetes symptoms. Diabetes is a chronic condition that affects millions of people worldwide, impacting the body's ability to regulate blood sugar levels. While the primary symptoms of diabetes, such as increased thirst, frequent urination, and fatigue, are well known, the condition can also manifest in various ways on the skin. In fact, the skin is often one of the first areas where the signs of diabetes can be detected. Recognizing these skin symptoms early can be crucial for timely diagnosis and management of the disease. Here are 15 crucial skin alarming signs of diabetes that everyone should be aware of. 1. Lipodystrophy. Lipodystrophy refers to a group of disorders characterized by abnormal or degenerative changes in fat tissue. These conditions can sometimes be associated with diabetes. Here's an overview of lipodystrophy and its implications. What is lipodystrophy? Lipodystrophy encompasses a spectrum of conditions where there is an abnormal distribution, loss, or accumulation of fat tissue. It can manifest in various ways. Localized lipodystrophy. This involves the loss of fat tissue in specific areas, leading to sunken or lumpy deformities under the skin. Generalized lipodystrophy. In this form, there is a more widespread loss of fat tissue across the body, affecting multiple areas and giving rise to a gaunt appearance. Mixed lipodystrophy. This involves a combination of both loss and accumulation of fat, with some areas showing lipoatrophy, loss of fat, and others showing lipohypertrophy, accumulation of fat. Lipodystrophy can occur as a primary genetic disorder or as a secondary condition associated with medical treatments such as insulin injections in diabetes. Insulin injections, especially when administered repeatedly in the same site, can lead to localized lipodystrophy. The causes of lipodystrophy can vary. Primary lipodystrophy is often caused by genetic mutations affecting fat metabolism and distribution. Secondary lipodystrophy can occur due to repeated insulin injections in the same site, causing fat tissue to degenerate locally. Symptoms of lipodystrophy may include changes in fat distribution. Visible changes in fat distribution, such as sunken or lumpy areas under the skin. Aesthetic concerns. Cosmetic changes that may affect self-esteem and body image. Insulin injection site issues. Localized lipodystrophy at insulin injection sites, characterized by indented or thickened areas of skin. Diagnosis of lipodystrophy is typically based on clinical examination and medical history. In cases of suspected secondary lipodystrophy due to insulin injections, the pattern and history of insulin administration are crucial. Treatment of lipodystrophy depends on the underlying cause and specific symptoms. Cosmetic management. For aesthetic concerns, options may include cosmetic procedures to improve appearance. Insulin injection techniques. Proper rotation of injection sites and techniques can help prevent localized lipodystrophy in individuals with diabetes. Management of metabolic complications. Individuals with lipodystrophy may also require management of metabolic complications such as insulin resistance and lipid abnormalities. The prognosis of lipodystrophy depends on the type and severity of the condition. Primary genetic forms of lipodystrophy may require lifelong management, while secondary forms due to insulin injections can improve with proper injection techniques and management. Lipodystrophy is a group of disorders characterized by abnormal changes in fat tissue distribution. It can be associated with diabetes, particularly as a result of insulin injections. Early recognition and appropriate management are essential to minimize cosmetic concerns and potential metabolic complications. If you notice any changes in fat distribution or skin appearance, especially around insulin injection sites, consult with your healthcare provider for evaluation and management options. 2. Acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by dark, velvety patches of skin. These patches can appear on various parts of the body and may indicate an underlying health issue such as diabetes. Here's a detailed overview of acanthosis nigricans. Acanthosis nigricans is a dermatological condition characterized by thickened, velvety, hyperpigmented, darkened patches of skin. The affected skin often feels like velvet and may have a raised, bumpy texture. It commonly appears in skin folds and creases, such as the neck, armpits, groin, and sometimes on the elbows, knees, and knuckles. Acanthosis nigricans can be associated with diabetes mellitus, particularly type 2 diabetes. It is considered a marker of insulin resistance, where the body's cells become less responsive to insulin, leading to higher insulin levels in the bloodstream. The exact cause of acanthosis nigricans is not fully understood, but it is often linked to insulin resistance and elevated insulin levels. Other factors that may contribute to its development include: acanthosis nigricans is more common in individuals who are overweight or obese. There may be a genetic predisposition to developing acanthosis nigricans. Certain medications and hormonal disorders can also contribute to its development. Symptoms of acanthosis nigricans include dark, velvety patches of skin that may be thickened and raised. Typically appears in skin folds and creases, but can also affect other areas of the body. Itching and a foul odor can sometimes accompany the patches, especially if they occur in areas prone to friction and sweating. Diagnosis of acanthosis nigricans is usually based on its characteristic appearance. In some cases, further evaluation may be needed to determine the underlying cause, such as blood tests to check for insulin resistance and diabetes. Treatment of acanthosis nigricans focuses on addressing the underlying condition and improving the appearance of the skin. Managing underlying conditions. Controlling blood sugar levels and addressing insulin resistance through diet, exercise, and medications, if necessary. Topical treatments. Prescription creams containing retinoids or keratolytics may help improve the appearance of the affected skin. Lifestyle changes. Weight loss and maintaining a healthy lifestyle can help reduce insulin resistance and improve skin symptoms. The prognosis of acanthosis nigricans depends on its underlying cause and how well the condition is managed. With effective management of diabetes and insulin resistance, the skin changes of acanthosis nigricans may improve or resolve. Acanthosis nigricans is a skin condition characterized by dark, velvety patches of skin that may indicate underlying insulin resistance and diabetes. Early recognition and management of diabetes are crucial to improving both skin symptoms and overall health. If you notice any changes in your skin, especially darkened patches in skin folds or creases, consult with your healthcare provider for evaluation and appropriate management. 3. Diabetic thick skin syndrome. Diabetic thick skin syndrome, also known as scleroderma diabeticorum, is a rare skin condition associated with diabetes mellitus. Here's an in-depth look at this condition. Diabetic thick skin syndrome, or scleroderma diabeticorum, is characterized by thickened, hardened skin that typically affects the upper back, neck, shoulders, and sometimes the face. The skin becomes firm, tight, and may feel woody or rubbery to the touch. Diabetic thick skin syndrome is considered a rare complication of diabetes mellitus, particularly type 2 diabetes. It is believed to result from increased collagen deposition and connective tissue changes in response to chronic hyperglycemia, high blood sugar levels. The exact cause of diabetic thick skin syndrome is not fully understood, but it is thought to involve microvascular changes and altered collagen metabolism due to prolonged exposure to high blood sugar levels. Risk factors include type 2 diabetes. It is more commonly associated with type 2 diabetes than type 1 diabetes. Poor blood sugar control. Long-term poorly controlled diabetes increases the risk of developing skin complications. Other diabetes-related complications. Individuals with diabetic neuropathy or nephropathy may be at higher risk. Symptoms of diabetic thick skin syndrome include thickened skin. The affected skin areas become noticeably thicker and may feel hardened or stiff. Texture. The skin may feel tight and less elastic, resembling the texture of leather or rubber. Limited mobility. In severe cases, the thickened skin can restrict movement, particularly in joints affected by the condition. Diagnosis of diabetic thick skin syndrome is typically based on clinical examination and the presence of diabetes. Skin biopsy may be performed to confirm the diagnosis and rule out other conditions. Treatment of diabetic thick skin syndrome focuses on managing diabetes and optimizing blood sugar control, blood sugar management, controlling blood glucose levels through diet, exercise, medications, and insulin therapy. Moisturization. Keeping the skin well moisturized with emollients to prevent dryness and further skin complications. Physical therapy. Gentle stretching exercises may help improve joint mobility and reduce stiffness. The prognosis of diabetic thick skin syndrome depends on the severity of the condition and how well diabetes is managed. With effective blood sugar control and proper skincare, symptoms may improve over time. Diabetic thick skin syndrome, or scleroderma diabeticorum, is a rare skin condition characterized by thickened and hardened skin, typically affecting areas such as the upper back, neck, and shoulders. It is associated with type 2 diabetes and underscores the importance of diabetes management in preventing complications. If you notice any changes in your skin texture or stiffness, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate management. 4. Bullosis diabeticorum. Bullosis diabeticorum, also known as diabetic bully or diabetic blisters, is a rare skin condition that can occur in individuals with diabetes mellitus. Here's a detailed description of this condition. Bullosis diabeticorum is characterized by the sudden appearance of large, fluid-filled blisters on the skin. These blisters are typically painless and can vary in size from a few millimeters to several centimeters. They often develop on the legs, feet, hands, and occasionally on other parts of the body. Bullosis diabeticorum is considered a cutaneous manifestation of diabetes mellitus, though it is relatively rare. The exact mechanism behind its development is not fully understood, but it is believed to be related to diabetic neuropathy, nerve damage, and microvascular complications affecting the skin. The primary cause of bullosis diabeticorum is believed to be diabetes mellitus, particularly in individuals with long-standing or poorly controlled diabetes. Other potential risk factors include peripheral neuropathy, damage to the nerves that control sensation and skin integrity, microvascular changes, diabetes-related changes in small blood vessels supplying the skin, trauma. Minor trauma or pressure on the skin may trigger the formation of blisters. Symptoms of bullosis diabeticorum include blister formation, sudden onset of large, clear or blood-filled blisters on the skin. Painless. Blisters are usually painless unless they become infected. Location. Commonly occurs on the lower legs, feet, and hands, but can also appear on other areas. Diagnosis of bullosis diabeticorum is typically based on clinical presentation and the presence of diabetes. A skin biopsy may be performed to confirm the diagnosis and rule out other potential causes of blistering. Treatment of bullosis diabeticorum focuses on managing diabetes and preventing complications associated with the blisters, blood sugar control, monitoring and controlling blood glucose levels through diet, exercise, medications, and insulin therapy. Wound care. Proper wound care to prevent infection and promote healing of blisters. Avoiding trauma. Taking precautions to avoid trauma or pressure on areas prone to blister formation. The prognosis of bullosis diabeticorum depends on the underlying control of diabetes and the management of skin lesions. With proper care and blood sugar control, blisters typically heal without complications. Bullosis diabeticorum is a rare skin condition characterized by the sudden appearance of large, painless blisters on the skin, commonly affecting individuals with diabetes mellitus. Early recognition, careful monitoring, and appropriate management of diabetes are crucial to prevent complications associated with this condition. If you notice any unusual blisters on your skin, especially if you have diabetes, consult with your healthcare provider for evaluation and management. 5. Diabetic skin infections. Diabetic skin infections refer to a range of skin conditions that are more common and may occur more severely in individuals with diabetes mellitus. Here's a comprehensive look at these infections. Diabetic skin infections encompass various bacterial, fungal, and other skin infections that occur more frequently in individuals with diabetes. These infections can range from mild to severe and may present with distinctive features due to the impaired immune function and altered skin microenvironment associated with diabetes. Types of diabetic skin infections. Cellulitis. A bacterial infection that affects the deeper layers of the skin and subcutaneous tissues. It typically presents with redness, swelling, warmth, and pain in the affected area. Boils and carbuncles. These are bacterial infections of hair follicles and surrounding tissue, often caused by Staphylococcus aureus bacteria. Boils are painful, pus-filled lumps, while carbuncles are clusters of boils. Fungal infections. Common fungal infections in diabetes include candidiasis, yeast infection, especially in warm and moist areas such as the groin and armpits, and fungal infections of the feet, athlete's foot. Necrotizing fasciitis. A severe, rapidly progressing bacterial infection that affects the deeper layers of skin and subcutaneous tissues. It is a medical emergency requiring immediate treatment. Impetigo. A bacterial skin infection characterized by red sores that can break open, ooze fluid, and develop a honey-colored crust. Diabetes mellitus predisposes individuals to skin infections due to several factors. Diabetes can weaken the immune system's ability to fight infections, making individuals more susceptible to bacterial and fungal invaders. Elevated blood glucose levels provide a favorable environment for bacteria and fungi to thrive. Peripheral neuropathy. Nerve damage associated with diabetes can reduce sensation in the feet and legs, increasing the risk of injuries and subsequent infections. Symptoms of diabetic skin infections vary depending on the type and severity but may include redness and swelling, inflammation of the affected area, pain or tenderness, especially with cellulitis or boils, warmth to the touch. The skin may feel warmer than usual, pus or discharge, especially with boils or impetigo, fever, particularly with more severe infections. Diagnosis of diabetic skin infections is usually based on clinical evaluation, including symptoms and physical examination. In some cases, a sample of the infected tissue, skin swab or biopsy, may be taken for laboratory analysis to identify the causative organism. Treatment of diabetic skin infections typically involves antibiotics or antifungal medications, depending on the type of infection and the identified pathogen. Wound care. Keeping the affected area clean and covered to promote healing. Control of blood sugar levels. Monitoring and optimizing blood glucose levels to enhance immune function and aid in healing. Preventive measures for diabetic skin infections include good blood sugar control, maintaining target blood glucose levels. Skin care. Keeping the skin clean, dry, and moisturized. Foot care. Regular inspection and care of the feet, including proper footwear and hygiene practices. Prompt treatment of injuries. Treating cuts, sores, or blisters promptly to prevent infection. With early diagnosis and appropriate treatment, most diabetic skin infections can be successfully treated. However, delayed treatment or severe infections may lead to complications, including spread of infection, tissue damage, or systemic illness. Diabetic skin infections are common and can vary widely in type and severity. Individuals with diabetes should be vigilant about skin care and promptly seek medical attention for any signs of infection. Maintaining good blood sugar control and practicing proper hygiene are key to preventing diabetic skin infections and their complications. If you suspect a skin infection or notice any changes in your skin, especially if you have diabetes, consult with your healthcare provider for evaluation and management. 6. Diabetic ulcers. Diabetic ulcers are open sores or wounds that develop on the skin, typically in individuals with diabetes mellitus. Here's a comprehensive overview of diabetic ulcers. Diabetic ulcers are chronic wounds that occur most commonly on the feet and lower legs, but can also develop on other pressure points of the body. They are a significant complication of diabetes mellitus, particularly when associated with peripheral neuropathy, nerve damage, and peripheral vascular disease, circulation problems. Types of diabetic ulcers. Neuropathic ulcers. Due to peripheral neuropathy, which reduces sensation in the feet and legs, allowing injuries to go unnoticed and untreated until they develop into ulcers. Ischemic ulcers, caused by poor circulation, peripheral vascular disease, that limits blood flow to the extremities, impairing wound healing and increasing the risk of tissue damage. Neuroischemic ulcers, a combination of neuropathy and ischemia, where both nerve damage and circulatory issues contribute to ulcer formation and delayed healing. Causes and risk factors. Peripheral neuropathy. Nerve damage reduces sensation, making it difficult to detect injuries and wounds. Peripheral vascular disease. Reduced blood flow to the extremities slows healing and increases the risk of tissue damage. Foot deformities. Structural abnormalities like bunions or hammertoes increase pressure points and skin breakdown. Poorly controlled blood sugar levels. Elevated glucose levels impair immune function and wound healing. Symptoms of diabetic ulcers may include open sores, wounds that do not heal or become chronic, pain or discomfort, especially with pressure on the affected area, redness or inflammation around the ulcer site, odor or discharge, especially if infection is present. Diagnosis of diabetic ulcers is typically based on clinical examination and may involve visual inspection, examination of the ulcer for size, depth, and signs of infection. Testing. This may include imaging studies, such as X-rays or MRI, to assess bone involvement or vascular studies to evaluate blood flow. Treatment of diabetic ulcers aims to promote healing, prevent infection, and reduce the risk of complications. Wound care. cleaning and dressing the ulcer to keep it moist and free of infection. Offloading, relieving pressure on the ulcerated area through padding, specialized footwear, or orthotic devices. Antibiotics, if infection is present or suspected. Surgical intervention, in severe cases, surgical debridement, removal of dead tissue, or vascular procedures may be necessary. Preventing diabetic ulcers involves foot care, regular inspection of feet for cuts, sores, or changes, and keeping feet clean and dry. Footwear, wearing proper fitting shoes and avoiding barefoot walking. Blood sugar control, monitoring and managing blood glucose levels to promote wound healing. The prognosis of diabetic ulcers depends on early detection, effective treatment, and optimal diabetes management. Prompt intervention can reduce the risk of complications, including infections and amputations. Diabetic ulcers are serious complications of diabetes mellitus, often occurring on the feet and lower legs due to neuropathy and vascular disease. Preventive measures, regular foot care, and timely medical attention are essential in reducing the risk of ulcers and promoting overall health in individuals with diabetes. If you notice any signs of skin breakdown or non-healing wounds, especially if you have diabetes, seek prompt evaluation and treatment from a healthcare provider. 7. Skin indentations. Skin indentations, also known as pitting or atrophic changes, can be a sign of diabetes and its complications. Here's a detailed look at this condition. Diabetic skin indentations are small depressions or pits that can appear on the skin. These indentations often occur due to underlying changes in the skin structure and subcutaneous tissue as a result of diabetes. They can be a visible indication of diabetic complications affecting the skin and underlying tissues. Skin indentations in diabetics are usually associated with conditions like diabetic dermopathy and lipoatrophy. They result from microvascular changes, poor circulation, and sometimes the effects of insulin injections. Several factors can contribute to the development of skin indentations in individuals with diabetes. Microvascular changes. Damage to small blood vessels due to prolonged high blood sugar levels can lead to changes in the skin and subcutaneous tissue. Lipoatrophy. Loss of subcutaneous fat at insulin injection sites can cause indentations or depressions in the skin. Peripheral neuropathy. Nerve damage can affect skin health and structure. Repeated trauma or pressure. Continuous pressure or minor trauma to the skin can lead to indentation. Symptoms of diabetic skin indentations include depressed areas, small, round or oval depressions in the skin, often with a pitted appearance. Location. Commonly found on the shins, but can also appear on other parts of the body, including areas frequently used for insulin injections. Color changes. The skin over the indentations may be lighter or darker than the surrounding skin. Diagnosis of diabetic skin indentations is typically based on clinical examination and medical history. The presence of diabetes and related symptoms support the diagnosis. In some cases, a biopsy may be performed to rule out other underlying conditions. There is no specific treatment for the indentations themselves, but managing diabetes and preventing further complications are crucial. Treatment strategies include blood sugar control, maintaining optimal blood glucose levels through diet, exercise, medications, and insulin therapy. Rotating injection sites. For those using insulin, rotating injection sites to avoid repeated trauma and lipoatrophy. Skin care. Using moisturizers and gentle skin care products to keep the skin healthy. The prognosis for diabetic skin indentations depends on the management of diabetes and prevention of further complications. With good blood sugar control and proper skin care, the risk of new indentations can be minimized. Diabetic skin indentations are small depressions or pits in the skin that can occur due to microvascular changes, lipoatrophy, and other complications associated with diabetes. Proper diabetes management and skin care are essential in preventing and managing these indentations. If you notice any unusual changes in your skin, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate care. 8. A skin rash. A diabetic skin rash, often presenting as multiple red spots or patches, can be a sign of underlying diabetes and related complications. Here's a detailed look at this condition. Diabetic skin rashes refer to various skin manifestations that are commonly observed in individuals with diabetes mellitus. These rashes often appear as red, inflamed spots or patches on the skin, and they can be associated with other diabetes-related skin conditions. Diabetic skin rashes are indicative of the body's response to prolonged high blood sugar levels and the resultant effects on the skin and immune system. They can also be a sign of poor blood circulation and immune response associated with diabetes. Several factors can contribute to the development of diabetic skin rashes. Elevated glucose levels can affect skin health and increase susceptibility to infections and inflammations. Poor circulation. Reduced blood flow, particularly to the extremities, can lead to skin changes and increase the risk of rashes. Diabetes can impair the immune system, making the skin more prone to infections and allergic reactions. Diabetes can lead to dry skin, which is more prone to irritation and rashes. Symptoms of diabetic skin rashes include red, inflamed areas on the skin that may vary in size and shape. These rashes can appear anywhere on the body but are often found on the legs, arms, and trunk. The affected areas may be itchy or have a burning sensation. Some rashes may become scaly or ooze fluid, particularly if infected. Diagnosis of diabetic skin rashes is based on clinical examination and medical history. Additional tests may include blood tests, to check blood sugar levels and other indicators of diabetes. Skin biopsy. In some cases, a biopsy may be performed to determine the exact cause of the rash. Treatment of diabetic skin rashes focuses on managing diabetes and alleviating symptoms. Blood sugar control. Maintaining optimal blood glucose levels through diet, exercise, medications, and insulin therapy. Topical treatments. Using creams or ointments to reduce inflammation, itching, and infection. Moisturizers. Regularly applying moisturizers to keep the skin hydrated and prevent dryness. Avoiding irritants. Using gentle, hypoallergenic skincare products to avoid further irritation. Preventing diabetic skin rashes involves keeping blood glucose levels within the target range, maintaining good skin hygiene and using appropriate skincare products, regularly checking the skin for signs of infection and seeking prompt treatment if needed. With proper diabetes management and skincare, the prognosis for diabetic skin rashes is generally good. These rashes often improve as blood sugar levels are controlled and skincare routines are followed. Diabetic skin rashes, presenting as multiple red spots or patches, are a common complication of diabetes. Proper management of blood sugar levels and diligent skincare are essential in treating and preventing these rashes. If you notice any unusual skin changes, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate care. 9. Xanthomas. Xanthomas are yellowish deposits of fat that can form under the skin, often presenting as raised bumps or patches. They are associated with lipid disorders and can be a sign of underlying diabetes. Here's a detailed overview. Xanthomas are deposits of fatty materials, primarily cholesterol, that accumulate under the skin. They appear as yellowish, raised bumps or plaques and can occur anywhere on the body but are commonly found on the elbows, knees, hands, feet, and buttocks. Xanthomas can be an indication of underlying metabolic conditions, including diabetes mellitus. In individuals with diabetes, especially those with poorly controlled blood sugar and lipid levels, xanthomas can develop due to high levels of fats, lipids, in the blood. The presence of xanthomas suggests that there may be an imbalance in lipid metabolism, which is common in diabetes. Xanthomas can develop due to several factors, including hyperlipidemia, high levels of cholesterol and triglycerides in the blood, often associated with diabetes. Uncontrolled diabetes. Poorly managed blood sugar levels can contribute to lipid abnormalities and xanthoma formation. Genetic factors. Some individuals may have a genetic predisposition to lipid metabolism disorders. Symptoms of xanthomas include yellowish bumps, raised, yellowish, or orange bumps on the skin. These bumps can be small or form larger plaques. Soft or firm texture. Xanthomas can vary in texture, ranging from soft and pliable to firm and rubbery. Commonly found on the elbows, knees, hands, feet, buttocks, and around the eyes, xanthelasma. Some xanthomas may be itchy or tender to the touch. Diagnosis of xanthomas typically involves clinical examination, visual inspection and physical examination of the characteristic lesions. Blood tests. To measure lipid levels, cholesterol and triglycerides, and assess blood sugar control. Skin biopsy. In some cases, a biopsy may be performed to confirm the diagnosis by examining the fatty deposits under a microscope. Treatment of xanthomas focuses on managing the underlying conditions, lipid management, medications such as statins or fibrates to lower cholesterol and triglyceride levels. Blood sugar control. Achieving optimal blood glucose levels through diet, exercise, medications, and insulin therapy. Dietary changes. Adopting a low-fat diet to help manage lipid levels. Topical treatments. In some cases, topical treatments may be used to reduce the size and appearance of xanthomas. Surgical removal. For cosmetic reasons or if the xanthomas are causing discomfort, surgical removal may be considered. Preventing xanthomas involves good blood sugar management, maintaining optimal blood glucose levels to reduce the risk of lipid abnormalities. Lipid control. Regular monitoring and management of cholesterol and triglyceride levels. Healthy diet. Eating a balanced diet low in saturated fats and cholesterol. The prognosis for xanthomas depends on the management of the underlying conditions. With effective treatment and lifestyle modifications, the appearance of new xanthomas can be minimized, and existing ones may regress. Xanthomas are yellowish, raised bumps or plaques on the skin caused by fatty deposits. They are often associated with lipid disorders and diabetes mellitus. Proper management of blood sugar and lipid levels, along with healthy lifestyle choices, are essential in treating and preventing xanthomas. If you notice any unusual skin changes, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate care. 10. Skin tags. Skin tags, also known as acrochordins, are small, soft, skin-colored growths that can appear on the surface of the skin. They are common in individuals with diabetes and can be an indicator of underlying insulin resistance. Here's a detailed overview. Skin tags are benign, soft, skin-colored growths that hang off the skin. They are usually small, ranging from a few millimeters to a centimeter in size, and can appear anywhere on the body but are most commonly found in areas where the skin folds, such as the neck, armpits, groin, and under the breasts. Skin tags are often associated with insulin resistance and type 2 diabetes. Their presence can be an indicator of metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. People with diabetes are more likely to develop skin tags due to changes in blood sugar levels and hormonal imbalances. Several factors contribute to the development of skin tags. Insulin resistance. High levels of insulin in the blood can lead to the formation of skin tags. Hormonal changes. Hormonal imbalances, often seen in diabetes, can contribute to the growth of skin tags. Friction. Skin tags commonly develop in areas where the skin rubs against skin or clothing. Genetic factors. A family history of skin tags can increase the likelihood of developing them. Symptoms of skin tags include: skin tags are small, soft, and skin-colored. They are typically pedunculated, meaning they hang off the skin by a thin stalk. Skin tags are generally painless and do not cause discomfort unless irritated by clothing or jewelry. Commonly found in skin folds, such as the neck, armpits, groin, eyelids, and under the breasts. Diagnosis of skin tags is usually straightforward and based on their characteristic appearance. Clinical examination. Visual inspection by a healthcare provider to identify the typical features of skin tags. Dermatoscopy. In some cases, a dermatoscope may be used to examine the skin tag more closely and rule out other skin conditions. Treatment of skin tags is often not necessary unless they cause discomfort or are cosmetically undesirable. Treatment options include cryotherapy, freezing the skin tag with liquid nitrogen to remove it. Excision. Cutting off the skin tag with a scalpel or scissors after numbing the area with a local anesthetic. Ligation. Tying off the base of the skin tag with a surgical thread to cut off its blood supply, causing it to fall off. Electrosurgery. Using an electric current to burn off the skin tag. Preventing skin tags involves managing underlying risk factors, maintaining optimal blood glucose levels to reduce the risk of insulin resistance and associated skin conditions. Maintaining a healthy weight to reduce skin folds and friction. Keeping the skin clean and dry, especially in areas prone to friction. The prognosis for skin tags is generally good. They are benign and do not pose a significant health risk. However, their presence may indicate underlying insulin resistance or metabolic syndrome, which require medical attention and management. Skin tags, or acrochordins, are small, soft, skin-colored growths commonly found in individuals with diabetes. They are associated with insulin resistance and can serve as a marker for metabolic syndrome. Proper diabetes management, weight control, and skin care are essential in preventing and managing skin tags. If you notice any new or changing skin growths, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate care. 11. Dry and itchy skin. Dry and itchy skin, known medically as xerosis and pruritus, is a common symptom in individuals with diabetes. Here's a detailed overview of this condition. Dry skin, or xerosis, occurs when the skin loses moisture, leading to a rough, scaly texture. Itchy skin, or pruritus, is an uncomfortable sensation that provokes the urge to scratch. These conditions often go hand in hand and can significantly affect the quality of life. Diabetes can lead to dry and itchy skin through several mechanisms. High blood sugar levels can cause the body to lose fluids, leading to dry skin. Diabetes can impair blood flow, particularly to the extremities, which can result in dry skin. Diabetic neuropathy can affect the nerves that control oil and moisture balance in the skin, contributing to dryness and itching. Several factors contribute to dry and itchy skin in individuals with diabetes. Elevated glucose levels can lead to dehydration and dry skin. Nerve damage can reduce sweat production, leading to dryness. Diabetes can increase susceptibility to skin infections, which can cause itching. Reduced blood flow to the skin can cause dryness and itching. Cold weather, low humidity, and hot showers can exacerbate dry skin. Symptoms of dry and itchy skin include: skin feels rough and looks flaky or scaly. Persistent itchiness, which can be intense and uncomfortable. Scratching can lead to redness, irritation, and even skin damage. Severe dryness can cause the skin to crack, leading to fissures and an increased risk of infection. Diagnosis of dry and itchy skin involves clinical examination. A healthcare provider will examine the skin and assess the symptoms. Medical history. A review of the patient's medical history, including diabetes management and any other underlying conditions. Blood tests. To check blood glucose levels and rule out other potential causes of dry skin. Treatment focuses on managing diabetes and relieving symptoms. Maintaining optimal blood glucose levels through diet, exercise, medications, and insulin therapy. Regularly applying thick, fragrance-free moisturizers to lock in moisture and soothe dry skin. Using mild, hypoallergenic skincare products and avoiding hot showers, which can strip the skin of natural oils. Drinking plenty of water to stay hydrated. Using a humidifier to add moisture to the air, especially in dry environments. Preventing dry and itchy skin involves keeping blood glucose levels within the target range to prevent dehydration and skin complications. Maintaining a consistent skincare routine with gentle, hydrating products. Protecting the skin from extreme temperatures and low humidity. With proper diabetes management and skincare, the prognosis for dry and itchy skin is generally good. Symptoms can be managed effectively, and the risk of complications can be minimized. Dry and itchy skin is a common symptom among individuals with diabetes, caused by high blood sugar levels, poor circulation, and nerve damage. Effective diabetes management and diligent skincare are essential in treating and preventing this condition. If you experience persistent dry and itchy skin, consult with your healthcare provider for evaluation and appropriate care. 12. Xanthelasma. Xanthelasma are yellowish patches that appear around the eyes and are commonly associated with lipid disorders and diabetes. Here's a detailed overview. Xanthelasma are yellowish, flat, or slightly raised patches that develop around the eyelids. These lesions are caused by the accumulation of cholesterol deposits under the skin and are typically seen in the inner corners of the upper and lower eyelids. Xanthelasma can be an indicator of underlying metabolic disorders, including diabetes mellitus. People with poorly controlled diabetes often have lipid metabolism issues, which can lead to the formation of xanthelasma. It is also associated with high levels of cholesterol and triglycerides in the blood, which are common in diabetic patients. Several factors contribute to the development of xanthelasma. Elevated levels of cholesterol and triglycerides in the blood, often seen in individuals with diabetes. A family history of xanthelasma or lipid disorders increases the likelihood of developing these patches. Xanthelasma is more common in middle-aged and older adults. Uncontrolled diabetes can exacerbate lipid abnormalities, leading to the formation of xanthelasma. Symptoms of xanthelasma include flat or slightly raised, yellowish plaques on the eyelids, usually near the inner corners. The patches are soft to the touch. Xanthelasma often appear symmetrically around both eyes. These patches are generally not painful but can be cosmetically concerning. Diagnosis of xanthelasma involves clinical examination, visual inspection by a healthcare provider to identify the characteristic yellowish patches, blood tests to check lipid levels, cholesterol and triglycerides, and assess blood sugar control. Treatment for xanthelasma focuses on managing underlying conditions and removing the patches if desired. Lipid management. Medications such as statins or fibrates to lower cholesterol and triglyceride levels. Blood sugar control. Achieving optimal blood glucose levels through diet, exercise, medications, and insulin therapy. Dietary changes. Adopting a heart-healthy diet low in saturated fats and cholesterol. Cosmetic procedures. Several options are available to remove xanthelasma, including surgical excision, removing the patches with a scalpel, laser therapy, using a laser to remove the deposits, cryotherapy, freezing the patches with liquid nitrogen, chemical peels, using chemical agents to remove the top layers of skin. Preventing xanthelasma involves good blood sugar management, maintaining optimal blood glucose levels to reduce the risk of lipid abnormalities. Lipid control, regular monitoring and management of cholesterol and triglyceride levels. Healthy diet and lifestyle, eating a balanced diet, exercising regularly, and avoiding smoking. The prognosis for xanthelasma depends on the management of the underlying conditions. While the patches themselves are benign, they indicate a need for better control of lipid levels and diabetes. With effective treatment, the appearance of new xanthelasma can be minimized, and existing ones may regress or be removed. Xanthelasma are yellowish patches that appear around the eyes, commonly associated with lipid disorders and diabetes. Proper management of blood sugar and lipid levels, along with healthy lifestyle choices, are essential in treating and preventing xanthelasma. If you notice any unusual skin changes around your eyes, especially if you have diabetes, consult with your healthcare provider for evaluation and appropriate care. 13. Excess skin. Excess skin, also known as loose or redundant skin, can sometimes be observed in individuals with diabetes, especially those who have experienced significant weight loss as part of their diabetes management. Here's a detailed overview. Loose or excess skin refers to skin that has lost its elasticity and fails to conform to the body's underlying shape after significant weight loss. This can result in folds and sagging areas of skin. While loose skin itself is not a direct symptom of diabetes, it can occur in people with diabetes who lose a substantial amount of weight as part of their efforts to control blood sugar levels. Significant weight loss can lead to excess skin because the skin, having been stretched for a prolonged period, may not fully retract to fit the body's new, smaller size. Several factors contribute to the development of excess skin in individuals with diabetes. Rapid or significant weight loss can lead to loose skin, as the skin does not have enough time to adjust to the new body size. Older adults are more likely to develop loose skin due to a natural decline in skin elasticity. The longer the skin remains stretched due to obesity, the less likely it is to return to its original shape after weight loss. Individual differences in skin elasticity, influenced by genetics and overall skin health, play a role. The prognosis for individuals with loose or excess skin depends on the extent of the skin changes and the chosen management strategies. While non-surgical methods can improve skin appearance and comfort to some extent, surgical intervention may be necessary for significant cases to achieve the desired results. Loose or excess skin can be a concern for individuals with diabetes who have experienced significant weight loss. It is important to manage this condition through proper skincare, gradual weight loss, and potentially surgical options if needed. If you are dealing with loose skin, especially after weight loss related to diabetes management, consult with your healthcare provider to explore the best options for treatment and care. 14. Keratosis pilaris. Keratosis pilaris is a common skin condition characterized by the appearance of small, rough bumps on the skin, often described as chicken skin. These bumps typically appear on the upper arms, thighs, cheeks, and buttocks. The condition occurs when keratin, a protein that protects the skin, builds up and blocks the openings of hair follicles. While keratosis pilaris itself is not directly linked to diabetes, people with diabetes are more susceptible to various skin conditions due to changes in their body's metabolism and immune system. Causes and factors contributing to keratosis pilaris. Keratosis pilaris often runs in families, indicating a genetic predisposition. Having dry skin can exacerbate the condition, as it makes the skin more prone to keratin buildup. The abnormal accumulation of keratin blocks the hair follicles, leading to the formation of bumps. Relation between diabetes and keratosis pilaris. Impaired skin healing. Diabetes can impair the body's ability to heal, making the skin more susceptible to conditions like keratosis pilaris. Diabetes weakens the immune system, increasing the risk of skin infections and inflammations. Diabetes can lead to poor blood circulation, which affects the delivery of nutrients and oxygen to the skin, increasing the likelihood of skin problems. Symptoms of keratosis pilaris. Tiny, rough bumps on the skin, usually painless and not itchy. Affected areas tend to be drier and rougher than the surrounding skin. Discoloration. The skin may appear red or brown in the affected areas, leading to uneven skin tone. Treatment and management. Regular use of moisturizers can help soften the skin and reduce dryness. Gentle exfoliation can help remove dead skin cells and clear blocked hair follicles. Topical treatments. Over-the-counter or prescription creams containing ingredients like lactic acid, salicylic acid, or retinoids can reduce keratin buildup. Proper skin care. Avoid long, hot showers and use mild soaps to prevent further drying of the skin. Prevention. Keep skin hydrated. Apply moisturizers regularly, especially after bathing. Use gentle skincare products. Choose mild, non-irritating products for skincare. Effective diabetes management through a healthy diet, regular exercise, and medication as prescribed by a healthcare provider can help maintain overall skin health. Keratosis pilaris is not a serious medical condition but can be uncomfortable and affect appearance. Proper management, particularly in individuals with diabetes, can help improve skin health and quality of life. 15. Chiral disease. Chiral disease, also known as Chiril's disease or hyperkeratosis follicularis et perifollicularis in cutem penetrans, is a rare skin disorder characterized by the formation of large, perforating papules and nodules, typically found on the lower extremities. This condition is often associated with systemic diseases, including diabetes mellitus, chronic kidney disease, and liver disease. In the context of diabetes, chiral disease represents a notable dermatologic complication that requires careful management. Causes and contributing factors of chiral disease. The condition is frequently seen in patients with chronic systemic diseases such as diabetes, renal failure, and liver disorders. There is an abnormal process of keratinization where keratin and other materials are deposited in the upper dermis. Metabolic disturbances commonly associated with diabetes can contribute to the development of chiral disease. Relation between diabetes and chiral disease. Chronic high blood sugar levels in diabetic patients can lead to various skin complications, including chiral disease. Renal dysfunction. Diabetic nephropathy, a common complication of diabetes, increases the risk of developing chiral disease due to associated metabolic disturbances. Diabetes impairs immune function and the skin's ability to heal, making it more susceptible to various skin disorders. Symptoms of chiral disease. Large, hyperkeratotic papules and nodules, often with a central core, primarily located on the lower legs. Itching is a common symptom, which can lead to scratching and further skin damage. The affected areas may show signs of inflammation and secondary infection due to scratching. Diagnosis. Clinical examination. Diagnosis is usually based on the appearance of the skin lesions and the patient's medical history. Histopathology. Skin biopsy and histological examination reveal the characteristic features of chiral disease, such as keratin plugs penetrating the epidermis and dermis. Treatment and management. Blood sugar control. Maintaining optimal blood glucose levels is crucial in managing chiral disease in diabetic patients. Topical treatments. Topical keratolytic agents can help in reducing hyperkeratosis. Systemic treatments. In severe cases, systemic treatments such as retinoids or vitamin A derivatives may be prescribed. If secondary bacterial infection occurs, appropriate antibiotics are necessary. Regular use of moisturizers helps in maintaining skin hydration and reducing irritation. Prevention. Proper control of diabetes through diet, exercise, and medication can prevent the onset and progression of chiral disease. Routine skincare, including the use of moisturizers and avoidance of skin irritants, can help maintain skin integrity. Regular checkups with a healthcare provider for early detection and management of skin complications. Chiral disease, though rare, is a significant dermatological condition in diabetic patients that underscores the importance of comprehensive management of diabetes and associated systemic diseases. Effective treatment and proactive skincare can help alleviate symptoms and improve the quality of life for affected individuals. In conclusion, understanding and recognizing the skin-related signs of diabetes is essential for early diagnosis and effective management of this chronic condition. The 15 crucial skin symptoms we've discussed can serve as important indicators of underlying blood sugar issues. If you or someone you know is experiencing any of these symptoms, it is vital to consult a healthcare provider for a thorough evaluation and appropriate treatment. Managing diabetes involves a combination of lifestyle changes, medication, and regular monitoring. By paying attention to these skin signs and seeking timely medical advice, you can better control your diabetes and prevent complications. Remember, early detection and proactive care are key to living a healthy and fulfilling life with diabetes. Thank you for watching. If you found this information helpful, please like, share, and subscribe to our channel for more health-related content. Stay informed and take care of your health.